Oh, big stretch. Hi, buddy. Hi, sleepy boy. Hey, buggers. Look how handsome you look. Hey, what you doing? Yeah. So today is the day that we are taking Harrison to go get his CT scan to see what we can find out about his head. So let's go. Look at the cute little head on your head. Yeah. Look how cute this is. We made it to the hospital. Gonna go walk down the hallway to go get his head checked out. The last time that I was here was when I was in college, and I actually used to volunteer here. Yes, they have totally remodeled the place. It's been a long time since I've been here. So I got off the phone not too long ago with Harrison's doctor, and he confirmed that he does have sagittal craniosynostosis, and he gave us the phone number to call for the pediatric neurosurgeon's office to get an appointment set up to go talk to the neurosurgeons down there at Primary Children's. So just waiting for a phone call back from them to get an appointment scheduled, but that's what we're currently waiting for right now. But I'm still in shock. I had a feeling that he had sagittal cranio, but until the doctor actually called and said yes, he has this, it was just kind of like not necessarily a blow, but just scary.
No video.
You're gonna wake the baby up.
Oh well, we're almost home.
Yep. How do you feel about it? Not helping.
And just Harrison talk.
Just Harrison talk?
Yeah.
So he learned a new thing the other day. Learned how to blow raspberries. I'll see if I can try to get
Go bear.
a video of him doing it, but he'll just sit there and with his lips, and it's really cute. But how do you feel about his diagnosis?
You got diagnosed?
Mm-hmm.
Needs to be done. Sucks, but it's better for him in the future.
Yeah.
And it's more common than you think. So.
Yeah. In a sense. Like 1 out of every 2,000 to 3,000 babies are born with it. So it's not, as common as like heart conditions are, because that's 1 out of every 100 babies are born with heart conditions. But so yeah, it's more common than we know, but not as common. It's still considered rare disorder. But regardless, he'll have to have surgery for it. So now the next step is just figuring out what surgery he's going to have, if it's supposed to be the endoscopic, or if it's going to be the complete reconstruction on his skull. So that is the next step. So we're not able to schedule the neurosurgery appointment today because the person that we need to talk to is out of the office, and they said that they would give me a call on Monday to get all that scheduled. So we should know next week on Monday when we can get in and talk with the neurosurgeons and start talking about getting Harrison scheduled for his appointment. So I'll keep you guys updated when we get to that point. So in my last video, I talked a little bit about what craniosynostosis is, and I'm gonna go over it a little bit again for you guys, just so to kind of give you a little bit of a refresher. But it's where the baby's sutures at the top of their head fuse prematurely. And so when a baby is born, they have sutures or open spots in their skull. It helps them move through the birth canal. So that's why when you see a baby after they're born, they have abnormal shaped heads. When they fuse prematurely, it makes it so that the baby's skull isn't able to conform and move throughout the birth canal. And then also too, it starts to create growth restrictions within their skull. Harrison has what is called the Sagittal Craniosynostosis, which is the suture at the top of his head. So he has the soft spot right here at the top. But then the opening, the sutures that run from that soft spot all the way back to the back of the head, where the sutures at the very back sides that come up at the base of the skull, they kind of come up at like a V angle. That entire suture from the front of his head all the way to the back is closed, is fused. That has created his football looking head, where it's really long and narrow at the top, and then at the very back of his head it kind of bulges out and kind of comes to a point. And so the only option for them to fix that is surgery. And there's 2 different types of surgeries. I don't know which one he's going to be eligible for. We'll have to see when we go into his neurosurgery appointment, see what surgery he can have. But the 2 different ones are the endoscopic one, where they go in and they just do a slit at the top of their head and they remove portions of the bone so that they can, like, the skull can open up and then it can grow and fuse back together again when it should. I've read that surgery is more suitable for younger babies. I've read that it's suitable for babies up to 3 months, but then I've also read that it's suitable for babies up to 6 months. The other option is the complete remodel. They call it the CVR, the cranial vault reconstruction. That's the one where they make a zigzag incision from one ear to the next, all the way up to the top of the head. And then they peel the skin back and remove the top portion of the skull and reconstruct it that way with dissolvable screws and plates. And so that one is that one's more invasive, and that one requires longer hospital stays, and it's a bigger scar and a bigger surgery. And so he's right in that middle age between them. He's 4 months old, so, you know, he might be eligible for the endo, or he might not and have to do the CVR. The main difference between the endo and the CVR is the endo, the endoscopic surgery. The babies wear the molding helmets. They wear those helmets for about a year because they have soft spots, and so their head isn't completely fixed after surgery, so they wear the helmet for the next year so their head can you know, mold back together the way that it should. Whereas with the CVR, the complete vault reconstruction, that one is done, their head is remodeled 100%, or, you know, essentially 100% right after surgery is over, so they don't have to wear a helmet. And so the reason why it's more invasive is because it's a longer surgery. They don't have to wear the helmet. They have the plates and the screws that keep their head together. So we'll eventually find out next week what option he gets. So I guess we'll wait and see for that.